All right, good morning everybody and welcome. I'm pleased to be here today to share a few words about the collaborative approach that our government is taking to address one of the most urgent social issues we are facing right now in the province of Alberta. Before I do, I want to acknowledge that we are gathered here today on the traditional territory of the signatories to Treaty 7, as well as the Métis people who have a deep connection with this land. I've often said that for some of the greatest challenges we face, not one level of government can address these alone. Part of my role as Minister of Municipal Affairs is to collaborate and help collaborate on important discussions. Many conversations with Calgary representatives have been around addiction, mental health, homelessness, and of course, community safety. I'm here with several of my Cabinet colleagues today to announce pieces of a framework that we've put together to support communities right across Alberta as local leaders and service providers come together to reach Albertans who desperately need help. We will hear today from Minister Milliken for Mental Health and Addictions and Minister Nixon for Seniors, Community and Social Services. I'll leave it to each of my colleagues today to share the details of the initiatives that they are bringing forward from their ministries, and reporters will then have the opportunity to ask questions. Our government takes the addiction crisis and its related concerns very seriously. We've heard loud and clear from municipalities across Alberta about the need for a collaborative approach, and we are committing to that, including right here in Calgary. With that said, I'll ask Minister Milliken for his remarks.
Move this up a bit. Thank you, Minister Schulz, and thank you everyone for coming here today. I am pleased to be here with this group of talented and committed individuals to discuss our government's next steps in tackling addiction, homelessness, and public safety issues here in Calgary. These social issues have impacted every community in Alberta, and Calgary is, of course, no exception. As a local MLA, I have seen firsthand the impact that these issues have had on our city, and I have heard many concerns from family, friends, and constituents. One Calgarian's comments in a CBC article from this summer summarizes the impact the addiction crisis has had on our city and on the day-to-day lives of its residents. They said, "I used to frequently take my children on the train and visit downtown parks, spend a day at the zoo, places where parking is somewhat inconvenient or expensive. Now, I wouldn't dream of taking my children on a bus or a train in Calgary. As a Calgarian, stories like this are heartbreaking to me, heartbreaking to hear. This is why we cannot stand idly by. We must take action to address addiction, which has become one of the most urgent social issues facing our city and the province. Since 2019, Alberta's government has taken action to provide more addiction treatment options for Albertans. We've expanded addiction treatment capacity, made opioid addiction treatment available on demand, and worked with police to ensure they are part of the solution. But our work cannot stop there. We are going to continue to build a system of addiction and mental health care that is focused on prevention, intervention, treatment, and recovery. To further address these social issues affecting our city, my Cabinet colleagues and I are establishing the Calgary Public Safety and Community Response Task Force. The task force will implement a series of initiatives in Calgary focusing on treatment, addiction, mental health and homelessness, and improving public safety. The Calgary Public Safety and Community Response Task Force will be chaired by Minister Nixon. We'll begin work immediately on implementing the $187 million in funding to address these issues in Alberta's urban centres. Specifically in Calgary, nearly $58 million of this funding will go directly towards addressing addiction and homelessness here in Alberta's largest city. The work this funding covers includes further increasing treatment capacity with a new recovery community in Calgary, transforming correctional living units into treatment centres, creating hybrid health and police hubs in Calgary's downtown, expanding medical detox services, deploying harm reduction and recovery outreach teams, expanding access to emergency shelter space, piloting a service hub model to increase access to recovery, and improving access to affordable housing options that support recovery. The funding behind these initiatives is in addition to more than $73 million in funding for Calgary shelter spaces and other housing supports this year, and the nearly $10 million already allocated to further increase access to addiction treatments beyond the 8,000 spaces initiative. The work of this task force will begin immediately, and I look forward to working with all of the members as we carry out this important work. Thank you very much. And then at this stage, I think it's best that I turn it over to Minister Nixon. Thank you.
That was definitely worth an applause. Thank you, Minister Milliken. Thank you, Minister Milliken and Milliken, for all of your great work and leadership on this file. I'm very pleased to be able to be here today, to be able to participate in this working group, and to be able to partner with so many great folks around the table here. There's been a remarkable amount of great work that's already been done in Calgary, and to be able to build off of that success and excellent work. So first of all, I wanted to be able to begin by thanking Minister Schulz, Minister Milliken, as well as Minister Ellis, who isn't able to be here today, but they've already been able to do a lot of remarkable work to get started here. And again, commend the City of Calgary and the partners that are behind here, but also all of our not-for-profit organizations who have been working diligently on the front lines to get the work done. And special thanks to my friend Patricia Jones with the Calgary Homeless Foundation, who has been able to provide significant leadership in helping bring our not-for-profits and community partners together to be able to collaborate and address many of the issues that we're facing on the streets today and in our communities. Addiction, mental illness, and homelessness have been top of mind for this government since we first took office in 2019. These are complex issues that don't have easy solutions. And we have, of course, been working on this since the beginning. We've had other task forces with great recommendations. And I'm pleased to be able to say that we've been working towards implementing those recommendations. And that's part of what the importance of this continued work is going to be, is building off of the success of the recommendations that we've put in and figuring out how we best move forward. So to introduce the members of the task force, I've already mentioned Minister Milliken, Minister of Mental Health and Addictions, myself, of course, Minister of Seniors, Community and Social Services, Minister Mike Ellis, Minister of Public Safety and Emergency Services, Minister Rebecca Schulz, the Minister of Municipal Affairs, Ruben Breaker, Councillor of Assiniboia, Siksika Nation, Jody Two Guns, Executive Director of Social Development, Tsuut'ina Nation, Sonia Sharp, Ward 1 Councillor, City of Calgary, Andre Chabot, Ward 10 Councillor, City of Calgary, David Duckworth, City Manager, City of Calgary, City Dongworth, Fire Chief, Calgary Fire Department, Mark Neufeld, Chief of Police, Calgary Police Services, Carrie Bales, Senior Program Officer, Provincial Addiction and Mental Health Alberta Health Services, Tony Passage, Associate Executive Director, EMS Operations, Alberta Health Services South Zone, and of course, Patricia Jones, the Chief Executive Officer of Calgary Homeless Foundation. The list of people I just shared with you is made up of individuals who have daily experience in dealing with individuals facing homelessness, mental health, and addictions. Of course, for me, my background is not-for-profit, spending my entire career before politics, serving Albertans in this way at the Mustard Seed, Canadian Mental Health, as well as the Boys and Girls Clubs of Calgary, working with homeless youth. And so I've witnessed a lot of the challenges firsthand. And my colleagues, Rebecca Schulz and Nick Milliken, talked a little bit about what the what is and the why. But I wanted to talk a little bit more about why we're here today and why this work is so important from my own experience working in the front lines. I first ran for office to bring a voice from the front lines. And that's what I intend to do here today and with this council in partnering with our great organizations and the many people that work in this field and have lived experience in homelessness. One of the hardest things that you can imagine is when you reach out for help to address your addiction or anything else, and there's no hand there to help you with that support or to provide that support. And you know, one example was a gentleman named Andrew that I was working with at the Mustard Seed, and for the longest time he was struggling with addictions. And I remember one day he came to me and he said, "I need help. I want to do something about this." And I said, "Okay, let's do something about this." And we got him down to the detox center, but there was no room for him. And he cried the whole way back because he was so desperate for that help. I remember another lady that I was working with on the floor of the Mustard Seed who became a risk to herself and to the rest of the people in the program. And we had to call the police. And they came and they picked her up. They brought her to the hospital. She was discharged 10 days later, and she was right back at the shelter. Nothing had changed for her. I remember when I was with the Boys and Girls Club of Calgary, one youth that was intaked and discharged from justice 8 times. It's completely unacceptable. I remember one night I was working down at the Mustard Seed, and this was every night. But one particular gentleman had become a complete risk to the folks around him, and the police came, picked him up, but they had nowhere to bring him. And so they ended up dropping him off about 10 blocks down the street. He made his way right back to us. We need to do better for folks like that. I know many situations where folks are dealing with significant health challenges, and they end up in the hospital to get the support that they need, and they end up getting discharged and to the shelter floor where they need better, more appropriate medical treatment. I also remember working at the Boys and Girls Clubs where about 65% of my youth were Indigenous, and working with them and working with our Indigenous partners to make sure that we had culturally appropriate program to help connect these young people with leaders and adults from their community to help them understand the rich history of their culture and help them to get a sense of pride and reconnect back into their community and the importance of that work, the impact that it was for those youth. The vision of the Mustard Seed when we worked there, and still is, was about community mobilization. It was about bringing community together to resolve issues. And I believe that that's what the vision of this committee is. And that's what you see behind us. We've brought community together. We've brought layers of government. We've brought service providers. We've brought Indigenous leaders together so that we can work towards addressing these very complex issues. Now, I'm thrilled because I do believe that Calgary, under some great leadership, has brought these communities together and has already paved the way and has had a lot of success in addressing these challenges. But since I worked the front lines, the challenges have gotten more complex, challenging. The addictions issues and the mental health issues have gotten worse. And so there's still work to be done. So I look forward to being able to build on the success of the great leaders behind me and the many great leaders across the city, and to partner with this team to continue to move forward to help address this very challenging issue of homelessness, addiction, and mental health in our communities. And with that said, we'll open up for questions from you.
We do have a few reporters on the line as well, so we're going to go back and forth from the floor to the phones. There's a stationary mic behind the cameras, just so your audio can get put into the feed. We'd ask that you use that. I see Alana's in line, so go ahead. One question, one follow-up, please.
Sure. Alana Smith, the Globe and Mail. I just wanted to touch on, you said correctional living units will be transformed into treatment centers, and there'll also be hybrid health and police hubs. I'm looking for specifics on these. So is the government considering legislation that would enable police or social agencies to hold someone who is intoxicated on drugs or alcohol in lockup longer to then put that individual into involuntary drug treatment?
So with regards to the new health and police hubs, those haven't quite been built out yet. So once we have those fully fleshed out, then we'll obviously be able to give you more details with regards to that. I think what you were talking about there had to do with individuals who were, I guess the best way to kind of look at it would be, is there a way for some of these individuals who are in the throes of addiction to be helped with regards to solving perhaps some of their issues of addiction? There's obviously a whole continuum of care that we've been building out with regards to that with the recovery-oriented system of care, which includes everything from aspects of harm reduction to making sure that we build out the capacity of treatment beds, also other aspects such as reducing user fees so that once people can get into treatment that they have that opportunity without any sort of a financial issue that could preclude them from being able to do that. So thank you very much.
Sorry, I'm not sure you answered my question. So I'm asking about the correctional living units being transferred into treatment centers. What exactly does that look like? And what is the government considering when it comes to involuntary treatment?
Sure. With regards to anything in, say, correctional living units, we're making sure that individuals who have been picked up into the justice system have access to health care immediately. One of the aspects that I think you probably might be aware of is our work that we've done with regards to VODP to make sure that individuals who have been picked up into the justice system have access, free and on demand, to evidence-based opioid addiction or opioid agonist therapy. So there's that. And then with regards to, I think, some of your comments with regards to interventions, I think you'll know from my mandate letter that I do have an expectation from the Premier to put together some recommendations with regards to that, to figure out ways to best intervene with individuals in their addiction. One of the things that comes to mind is when you have an individual who has overdosed perhaps 4 times in one day, we don't really have a very good mechanism with regards to ensuring that we can ensure that that person gets the help that they need or want. And so we're definitely looking at all options to see if we can figure out a way to best help those individuals and save their lives. Thank you.
Michael King, Global News. What specific metrics are you going to be using to measure the success of this task force?
Well, I guess with regards to outcomes, part of it will be ensuring that we follow individuals throughout their recovery journey. One of the aspects that our government was front and center with regards is to make sure that individuals who are, say, using certain services, that we try to make sure that we can get data such as personal health numbers and things of that nature, right? Obviously, if somebody is going to use SCS, we're not going to deny them services if they don't provide that. But what we can do with that information is we can follow the individuals that we have interactions with to ensure that they're progressing in their recovery. I would also just mention that we also have some of the most transparent data with regards to some of the issues that this complex issue of addiction that we're all facing, and that can be found at the ACES website. So there's all the information, somewhat geographical even, with regards to calls for EMS, overdose experiences and things of that nature. So all that information is available, and we're using that in order to then be able to inform decisions as we move forward to ensure that the supports that we have are used in the most marginally beneficial way. Thank you.
It was mentioned right off the top that transit plays a role in this as well, with people not feeling safe in Calgary, taking the C train, going to LRT stations. What specifically is going to be done from this task force in terms of transit safety?
Well, as you know, we're going to be beginning the work on this with regards to this task force immediately. On the transit piece, I would actually say that I think that falls within the public safety minister's portfolio, and so I probably wouldn't be the best to answer on that. What I would say, though, and I wouldn't speak on behalf of him for that, but I'm sure that his office will be able to get you further information on that.
Radio-Canada. There was a very similar announcement that was made in Edmonton this week. It came sort of after a series of crime. Could you give more details about the specific problems that we see here in Calgary?
A lot of the issues that we see in Calgary are similar to the ones that you see in Edmonton. The urban areas that you see, the 2 biggest cities in Alberta, both Edmonton and Calgary, have seen they've borne their larger share of issues on this matter. And so what we are doing with regards to these task forces is to ensure that the resources that we have immediately and available to be deployed are used in, like I said, the most marginally beneficial way. I think that we're going to be able to make a lot of inroads in our 2 biggest cities. As you mentioned, there's another task force that we have also struck in Edmonton, very similar to the one here in Calgary. It was very well received. I think that there were some very good quotes from even the chief of police saying that in Edmonton, Chief McPhee stating that he felt that this was real leadership, and it was the first time, this is a paraphrase, but it was the first time that he'd seen the right ministers and the right group of people coming together to ensure that we can affect positive change for this very, very complex issue that we are experiencing across Canada called addiction. So thank you.
And just to add to that, one of the things that I had pointed out at that announcement in Edmonton is that we do see these concerns across the province, but the challenges that we're seeing in each of the cities is unique. So what we're seeing in Lethbridge is different from what we're seeing in Calgary. It's different from what we're seeing in Edmonton in terms of the patterns we're seeing, the organizations who are on the ground, the nonprofits who are involved. and just the way different cities manage different aspects of this. And so this is why we have these very specific groups of people pulled together at the community level so that we are able to have some flexibility in how we respond in a way together with community partners, the city, the police service, the fire service, in a way that matches the needs of that specific community.
I have a question for Mark Neufeld. How is this new task force going to help the crimes in the city and everything that police deal with?
Great question. Thank you very much. I think probably the big piece that you see here is the level of coordination and alignment. When you look around across the spectrum of the leaders that are here and the organizations that are represented, they're engaged and involved on the ground with their teams. And lots of good work is being done, as we know. But I think it's in the coordination and the alignment of that work, making sure that we're all engaged across the continuum. There's certainly a place for police to be specifically engaged, but there's many times where police are not the best response. And it's great to be able to see leaders at this level coming together to make sure that we coordinate the efforts all across that continuum so that we can have the best outcomes for the people that are struggling with addictions, as well as the people in the community that are communicating that they're feeling unsafe.
Hello, it's Scott Dipple from CBC Calgary. For whichever minister would like to answer, I see with the heads of a number of organizations as part of the task force, was Mayor Gondek invited or was she informed of this plan?
Yes, Mayor Gondek is aware of this task force coming together, and it is a little bit more operational. That said, I was very clear with the mayor that we would love to have her input, and as we move through or make decisions or make announcements or need additional input, that absolutely she will be invited to be at the table, and we will make sure that she is kept up to speed on the work that's being done from the folks that you see behind me here today.
Okay, and to follow up, can you just give an example, perhaps a tangible example of how having a task force in place would either allow actions to happen quicker, or what would be different as opposed to the present system we have right now, various funding partners involved with agencies on the front line, that sort of thing?
So that's a great question, and to answer it, I'm going to use an example from Edmonton, and I used this earlier this week, that, you know, it was just a couple of weeks ago, and we were sitting looking at the front page of the Edmonton paper about the issue of homelessness in the downtown core. And as I was in discussions with the city, talking about additional shelter spaces, in contact with Minister Nixon, realized that we had shelter capacity. We had different numbers than maybe the city had, and we had a major issue because there were concerns being raised about law enforcement, LRT, safety in the downtown core. And really, as we worked through that, we decided not only did we need to all be working from the same set of information, make sure that all of our collective work is going in the same direction towards that recovery-oriented system of care, and that when we need to address these urgent short-term concerns, that yes, we're all rowing in the same direction towards that long-term vision, but that we have the right people in the right places sitting around the table to make quick decisions where we need that to happen.
Thank you.
Hi, Austin Lee, CTV News. Not sure who would want to answer this one, but I'm just wondering if there's any consideration in the near or long-term future to increase supervised consumption capacity, not only in Edmonton and Calgary, but anywhere else in the province?
Thank you very much for the question. Supervised consumption sites fall under the idea of services that can help to reduce harm. And that is absolutely part of the full continuum of care for the ROSC model, the Alberta model, the recovery-oriented system of care that we have been working to implement over the course of the last 3+ years. With regards to expansion services, things of that nature, we are always working with communities. We are always talking to stakeholders and looking to see if there are places where there is unmet need. If and when we find those kind of situations, then we have to then obviously work with the communities to see if it's something that would work for that. So thanks.
Okay. So I guess just to follow up, no specific conversations about, say, for example, in Lethbridge, I know it's a hot button issue. Has there been a conversation around that recently?
With regards to Lethbridge specifically, what I would actually say is that there have been conversations throughout the province on this. One specific example that I can bring to mind is that in Edmonton, I know that there was discussions with regards to an unmet need south of the river, and I believe that there was consultations with regards to a potential new site. I think it was actually only 2 nights ago, with the community, because that community engagement is obviously very, very important. Thanks.
Hello, Brody Thomas, Calgary Herald. Just wanted to clarify, is there any legislative changes planned that would come into effect to potentially hold someone involuntarily for treatment purposes?
So as I mentioned with regards to my mandate letter, I have been tasked with regards to putting together recommendations which could include something along this topic. What I would truly say, though, is again, if we have situations where somebody is overdosing 4 times a day, we need to have some sort of compassionate intervention mechanism to ensure that we can figure out ways to ensure that he or she gets the treatment that they need or want. And the ultimate goal there is to ensure that we can work towards saving people's lives.
And I guess as a follow-up, Edmonton Mayor Sohi was concerned with how this was rolled out in his city. I understand you've talked to Mayor Gondek. Have you reached out to the mayor in Edmonton to follow up with his concerns?
Yes, the mayor of Edmonton was aware that this was happening, and I know both of the city councillors that are on our Edmonton task force also made it clear that they were aware. I know that in Edmonton they have a process, so in order for the city manager and the fire chief, who were invited to be part of that task force, before they're able to participate, that has to be passed by mayor and council, and we sure hope that they do see the value in those folks participating on our Edmonton panel as well.
Great, and this will be our last set of questions. There's no one on the line. Just before the questions, after this, we're going to go down to the Six Sicko room, and media will have a chance to film some B-roll once the committee is set up.
Hi there, Mark Villani with CTV Calgary. Just a question. I'm wondering if Patricia Jones might be able to answer this one. Wondering where we're at with warming spaces here in the city and how this task force will help the most vulnerable, especially as we hit those minus 30-degree temperatures in the next few weeks here as it gets colder and colder. A lot of shelters are experiencing that overcapacity.
Yeah, so your question is about the availability of warming spaces?
Yeah, correct.
Yeah, I would say, first of all, what I would say is this task force, I think, is cutting edge, and that you're having all these ministries together is the only way we're going to make change, and relationship is king. We have an incredibly good relationship with the City of Calgary and the provincial government, and have worked together with them to create over, I think it's 12 or 14 warming spaces. But warming spaces are not the issue. It's important to have warming spaces, but what they are is doorways, so people who are suffering can have access to services they need to thrive in their lives. Because as much as people may think that you wake up in the morning and you don't want the life that you have, most of the people we serve really want a different life. So the warming space is a doorway into having other services to recover.
Just another question for Minister Nixon as well. Just talking a little bit about some of these homeless organizations that have staff that are underpaid right now. There's a lot of staff shortages in place right now. How will you support those staff members that are struggling to help the most vulnerable?
For sure. No, I appreciate that, and I share their concern. I have been working on that, and thankfully, my first conversation with the Premier, I brought that topic up. She shared my concern, and so part of my mandate letter is addressing some of the workforce challenges across the social sector. So stay tuned, and I hope to have good news on that front soon.
Okay, perfect. If the task force members could follow that gaggle of staff over there, they will lead you to the Six Sicko room. For media, it's just on the main floor. We'll invite you in once the task force is set up to shoot some B-roll if you'd like. Thanks, everyone.